afternoon. Thank you so much for joining us. On behalf of Community Health Foundation, welcome to Break for Health. I'm Joan Elder, the program coordinator for this series of virtual sessions that address different topics related to health and well-being. Today, you are joined by 81 people in the audience, and we're also joined by some local experts in the field of addiction. I'm so pleased to have our moderator, Nettie Carter-Smith, joining us again. Nettie will keep things moving along and will absolutely get to your questions. And I'm sure that you're going to learn a lot today. I also want you to know that we have technical support from Alex Miller, who is with Shiftology. And in the chat box, you'll see that Alex has entered his email address. If you have any issues that come up while you're on the session, he will keep an eye on that and do all that he can to help you out. You'll notice that the screen today is going to look different from other Zoom meetings that you might have been on. In this session, you will only see the presenters on your screen. Audience members do not have video access, and you also don't have your microphone access. If you have a question that comes up during the session, please enter it in the Q&A box in the center of the bottom part of your screen. We'll be keeping an eye on that, and Nettie will be sure to get back to those questions as we can, as we have time today. You'll see that the chat window is also available to you. You may see some information, resources, or ways to get a hold of folks when our presenters have something that they would like you to see. So those messages will pop up for you. And there is a box on the bottom right that says CC. This session is being recorded, and there is a live transcription going along with it. So if you prefer not to see that, go ahead and click on the CC box and you'll have an option to hide subtitles. So feel free to do that if you prefer. As I mentioned, this event is being recorded. It will be available on the Community Health Foundation's website afterwards. So if there's something that you missed and you want to go back to see it, it'll be available to you. And you can certainly refer any other friends who missed it today so that they can go back to see the session. And don't forget, we have some great raffle prizes, which are going to be awarded at the end of today's session. So please stay with us until the very end. I have certificates from Young's Dairy and also from Lee's Famous Recipe. So these are some really great items, and I hope I don't have enough for everybody, but good luck on the raffle. So it's my pleasure now to turn this session over to Nettie Carter-Smith, and she is going to kick us off with our first poll questions.
Yes, thank you, Joan. Good afternoon. Sure. She always does this. Okay, so it's lunchtime, right? And the raffle prizes are food related. I haven't eaten yet, so maybe someone will draw my name. But anyway, welcome everybody to another conversation of Break for Health. And this time we're going to focus on addiction. As Joan mentioned, we've got some poll questions that we want to ask. We also want to take this time to just thank all of the panelists who look absolutely amazing. You're going to meet them in a couple of minutes. And we're wearing blue. April is the month for child abuse prevention. And today is the day that you're supposed to wear blue to work. So we've gotten together, coordinated. We've got the blue on. I see you, Wendy. Yep. So thanks to everybody for wearing blue. And it's also, if you did not know this is Alcohol Awareness Month. So what a great month to have a conversation about such an important topic. So we'll give you guys a couple more seconds to answer those questions. And then once our panelists introduce themselves, they're going to share with you what their favorite flower is, what their favorite spring flower is. So without further ado, I'd like to take this opportunity to have each panelist just take a minute or two to introduce yourselves to the audience so that we know who you are. I'm first going to start with Dinah.
Hi, I'm Dina Rowley-Hafey, and I'm a sophomore at Springfield High School. I'm also a second-year member of the Ohio Youth-Led Prevention Network, along with a member of the BATS organization, which stands for Bringing Awareness to Students. And my favorite spring flower is a tulip.
Okay. Thank you, Dina. Beth Dixon.
Hey, everybody. I'm Beth Dixon. I'm with Wellspring. I'm a prevention education coordinator, which means I teach BOTVIN in the schools. I'm a PACS partner. I'm also an adult ally for the BATS program bringing awareness to students, and I work with Youth Led.
Great, thank you. Frank.
Frank, I'm the manager of the Alamo Club and also a member of two 12-step programs. I'm required to say this. When I speak, I do not speak for the Alamo Club or the 12-step programs. I speak with my experience and understanding in my own for my dedication to those two organizations. And my favorite flowers are geraniums, red geraniums. I plant a box just full, and they're beautiful, and they last till the freeze comes.
Okay,
Pat.
great. Thank you. Preston.
Hi, everybody. Preston Moore. Professionally, I work for Columbus Springs Hospital. Columbus Springs has two hospitals in the greater Columbus area, over in Dublin on the west side and by the airport on the east side. We're a fully functioning 24/7 mental health and addiction hospital. So when people in community or in your family is struggling with, suicidal or homicidal challenges, schizophrenia, they're manic or any kind of detox, drug and alcohol detox, they would come to a hospital like us. And then we follow that up with 5-day and 3-day mental health and addiction group therapy. And we serve about 2 hours outside of the greater Columbus area. That's what I do professionally. Personally, I've been in recovery from drug and alcohol addiction for about 20 years. I was one of these kids that a lot of times we talk about in community, started getting in trouble in high school on through my younger years. And I got sober a month after my 21st birthday. And I also host a podcast called The High Cost of Anonymity. And part of the way I think we move the conversation forward to normalize mental health and addiction is not necessarily normalizing people like me, drug and alcoholics that are kind of on the top of the triangle that are, need to go to treatment. It's normalizing basic things like counseling, support groups, group therapy, that kind of thing. And those are the topics I explore. Favorite flower? I'm from Texas. The bluebonnet. We love
bluebonnet, BB, and you got your blue shirt on today.
That's
How about that?
Thank you. Thanks for having me.
Yeah, we look forward to hearing about more of that later in the conversation. Melanie.
Hi, my name is Melanie Silvis. I'm a clinician at Monday Community Correctional. I'm also the Clark County Director of FOA. And we kind of provide support for families and those in recovery. And we also help direct those who maybe are in active addiction to the resources that they need. What we do at FOA is, like for the family side, we really try to go over things like what's enabling, setting boundaries, what's codependency, what does that mean, and, have those family members kind of work to figure out what they're doing, what they can do to support their one in recovery as well. And my favorite spring flower is probably tulip.
Tulip. Good one. Okay. Sherry.
Hi, I'm Sherry Haynes, manager Mercy Reach, which is an outpatient alcohol, drug, and tobacco treatment program. We have offices here in Clark County and Champaign County. Our programs that we offer is outpatient. We do have IOP, intensive outpatient programs. We also have a detox program where we use Springfield Regional Medical Center. We do have medication assistant treatment as well with Vivitrol. And we do have a very strong case management navigator program that offers a lot of assistance to help reduce those barriers for clients. I have been in the field for 35 years. A little bit about my background, as though I've never struggled with addiction. I was raised with a very late stage alcoholic father. So I am the model child for the adult child of an alcoholic, the family hero, which has brought me in the field to help children, mostly give them back their parents sober, because I've been on the other side of the fence. So I have spent many years helping people struggling with addiction, knowing how it affects the family. So I really appreciated all the questions about how do we help children, how do we help the family members, how do we help the spouses, because that's really hard. I've always joked that I found myself on this side of the desk versus finding out if I actually had the addiction because it scared me too much. So hopefully we can answer a lot of questions today and help people out with a lot of resources.
We've got a lot of resources around this panel today, and I'm so excited. So last but not least, I want to introduce my friend and colleague, Wendy Doolittle, who's the guru, ladies and gentlemen, at McKinley Hall. Wendy's going to introduce herself, but then she's going to just go right into the climate. What is the temperature of addiction here in Springfield? What are we doing to start the conversation? Wendy.
Good afternoon. My name is Wendy Doolittle. I'm not a flower person, so if a sunflower is a spring flower, that's mine. So this area of healthcare, which is brain health, is one of my life passions. I'm an old timer like Sherry, so I've been in the field about 30 years. I'm currently the CEO at McKinley Hall, where we serve adult men and women who are struggling with substance use disorders. So we offer a full continuum of services from withdrawal management to residential and outpatient treatment services. But even a bigger part of that are the supportive services that we offer, which include recovery housing, peer support services, and then case management services for children who are in the care of parents who are engaged in treatment services. Because we do view this as a disease that affects the entire family. So just a quick temperature, because I know we don't have a lot of time and I want to make sure we can get to as many questions as possible. We continue to hear that the drug overdose deaths in Ohio or during COVID have exceeded the highest that we've ever had in 2017. And while we might not be seeing the death rate as high in Clark County, we still see the overdoses as high. But overall in the state of Ohio, we have so far had, from what they've been able to calculate, there's still a few more out there not quite confirmed, 4,873 deaths for 2020 compared to 4,854 in 2017. So yes, COVID has significantly impacted this population. So the rates appear to be contributed to that are impacting this is COVID, but also the rate of fentanyl and all of these other substances that people are getting a hold of and are being sold on the streets. So COVID resulted in what? Agencies were having to do telehealth, 12-step meetings were closed down, and this went on for several months. And isolation is one of the hardest situations for anybody that's dealing with this particular brain disease. So Clark County has experienced a significant increase in treatment capacity over the last few years. We have many programs now that offer outpatient assisted treatment, medication assisted treatment, and that's typically for opiate addicts, but we are seeing increases in meth. And we're also seeing a spike in cocaine again with some of the patients. So while we have those services available, we still, it appears that maybe patients that could benefit from residential are still choosing outpatient because it is least restrictive, but they're in need of residential. So that drastically affects their ability to maintain abstinence. I would also say that our community is working really hard to help everybody in the community to understand this as a brain illness. You know, Preston talked about normalizing treatment and counseling. We should be talking about this illness as a brain disease the same way we talk about cancer and every other disease that we have, because stigma prevents people from seeking help. It prevents families from seeking help because they're so concerned about what other people think, because we have such a large population that still doesn't understand this, despite the fact that so many loved ones have died. So there's a great deal of shame attached, and there's a lot of trauma that folks in recovery deal with, people in active addiction to deal with. So I will pause there and hand this back to Nettie so we can take some of your questions.
So my question is, and you kind of went back to this a couple of times about the disease and the mindset for that versus whether it's a choice, whether it's a brain disease. Can you talk a little bit more about that? And I'd actually like to hear from some of the other presenters too, but if you want to start, that would be good.
Sure, I'll chime in first. Excuse me. First, I'll say that there's tons of research that shows that in the brain, there are clear changes that take place for someone who is addicted. But there's also changes in the brain of offspring of people who have been addicted. So there's a clear difference when you look at these scans where you can see that these brains are different. So that piece alone tells us this is something that's related specifically to the brain. Now we need that brain to make choices, right?
Right.
So here's the catch though. The Medical Association Society has talked about making this a pediatric illness, identified as a pediatric illness. And that is because you make the choice. Most youth starts during adolescence, right? Now, when you think about that, our prefrontal cortex is not fully developed until around the age of 25. So yes, these kids are making a decision to use and to begin experimenting with, but they're not doing it. They're not executing this decision with the brain, number one, that's fully developed. And once they have started that cycle, once they have turned on the switch in the brain, now you've activated the disease. And so now the process looks completely different. So when people say it's a choice, yeah, you can call it a choice, but we know what kind of choices adolescents make sometimes, particularly because their prefrontal cortexes are not fully developed. So there's your big difference between saying it's a choice as opposed to having this illness and some people even being predisposed.
Right. Sherry, do you have anything to add?
Yes, as I was going through all these questions, I did a lot of research to make sure I had all my ducks in a row here. And, to throw out some clinical ASAM, the American Society of Addiction Medicine, their definition of addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addictions use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. And I always, when I do my presentations, people can understand more about someone who has diabetes. It's a disease, just like addiction is a disease. So when someone has diabetes, the doctor has told them you need to watch what you eat, keep your sugar low, exercise, healthy weight, but frequently, not all the time, don't want to make a whole, that everyone does this, but people choose not to follow those directions. And they can have complications from the diabetes. And it's the same with addiction. People become into treatment, they receive all kinds of information, education, tools to help them to gain their sobriety. But sometimes people choose not to follow some of those rules because individuals need to learn themselves. That didn't work, so maybe I need to try this for sobriety. So there's a lot of different definitions as I was going through this, but ASAM is the American Society of Addiction Medicine, and I think that gives a broad overview.
Okay,
If
great.
I could hop in one more time, if it's okay, I just wanted to add to that because the brain is impacted, it makes it very difficult when you're in treatment sometimes to just kind of follow that. There are people that are trying to follow kind of the guidelines, if you will, or the treatment that has been prescribed, but the cravings are such, it is difficult to do. And they're trying to do that with a brain that has been altered. And that's after the drug has been introduced and there's not a substance in your system right now. Your brain still remains altered. It's not just altered when you use, it remains that way until you start to develop new neural new neural pathways in treatment. So I just want to throw that piece in there.
Okay. And there's a process for that. I mean, obviously, you
Absolutely.
can't put necessarily a time frame on that, correct?
No,
and
everybody is different.
Yeah, and many people do get frustrated with the individual who's struggling. And I even have to sometimes remind my staff, they're under the influence. They're not thinking clearly.
Right.
They're not making good choices because, they're under the influence. They're affected by a drug and the changes in their brain where they're not making good choices and decisions. And we have to help them. That's why treatment can be 60, 90, 120, 6 months, 9 months, depending on a person, what they need, why the brain is changing.
Mhm.
So it's a healthy reminder for all families, even though this is very difficult
Right.
on families, that individuals are under the influences. They're not making good choices and decisions.
Right.
And
Okay.
can I add something to
Yes.
that too as well? I believe a lot of that also is, if you even take the drug out of it and they've been in, say rehab for a little bit, it's a behavior change that has to happen with those choices. It's really not so much even at the point of, urges and things that they have that they want to use the drug. It's about doing the same behaviors that they've been doing all
Right.
along. So to
Right.
make those choices, I've got to change. If this didn't work for me, like you said, Sherry, I need to try something different, but it's
Right.
always about actually going out of that comfort zone that they've been in for so long
Right.
to be able to make a different change with their own behavior. So
That's a good point to add. That's a great segue. We could probably talk about this for 3 hours, but we're going to move on because the next section, we're going to talk about treatment. And I've got like a couple questions that people have already asked. So let's move to the second poll. Can we get the second poll question? There we go. And I'm sure everyone can relate to this. This question, the first question, do we know anyone who struggles with addiction? And what do you think is the most commonly abused substance? So let's give that a couple seconds and see our answers. Let me ask the experts. Question number 1. More than half obviously have a family member, or 22%, more than 80%, 90% know someone's stated themselves. And then number 2, alcohol, 56%. I'm going to ask the experts, is that correct? Is it alcohol? That's any of the panelists.
My vote's alcohol. That's just a guess.
Okay.
I would say alcohol as well. I mean, I think that goes back and forth, but I always hear alcohol is number 1.
And I've always heard nicotine just
Me
because
too.
cigarettes
Okay,
are so readily available to kids and everything else. I don't
Right.
know.
And I'm not the guru. What?
Yeah, I think with young people it's nicotine, but like I think with adults it's definitely alcohol. My
Okay.
brother struggles with addiction with alcohol, so I would vote alcohol for adults, but nicotine for kids.
Okay. All right.
Nettie, we recently, Wellspring actually polled middle and high school students, and we asked them, what do you think is the number one health concern among kids your own age? They said anxiety and depression. Among adults, though, they said alcohol.
Wow. Okay. Thank you. Well, let's talk about treatment and treatment options. There's a question that was brought up by Susan, and she's asking, when transitioning her teenage son home from residential, there was a significant struggle to find services to meet his need. What in-person services are available in Clark County for teens? So we could do that twofold. Let's talk about teens and adults, but let's take her first part of the question first. Sherry, do you want to start?
Yeah, Mercy Reach, we do work with adolescents. And anyone that is coming out of a residential program, I believe it is a requirement that they have set in place an appointment for a reduction of level of care. So there's a handoff. We do work with adolescents. We don't have, like I say, we don't have an IOP program for adolescents, but we do work with on an individual basis. And, we will do an assessment at the step down level to see what services they need. We do try to connect our adolescents into sober functions, sober support, sober activities as much as possible. We work with the parents to help them still to watch their child's behaviors. So both Champaign and Clark County, we do work with adolescents.
Anything else to add? Okay, we've got another question, and this one's for Dina. What do you see as the main barriers for youth to seek treatment for substance abuse?
I was just reading that and thinking about it. And I think young people often just don't know who to contact. And even though, there's posters and pamphlets in the schools, they're still not sure if this is the right one. There's so many options, and there's not always someone telling these kids what's the best choice for them, along with just feeling pressure from their friends that maybe still are abusing substances and think it's like, oh, it's cool or whatever they think. And they almost feel ashamed to seek help if their friends found out is another big one.
Yeah. Does anyone else want to try to answer that?
Eddie, one of the things that I find that I do a decent amount of volunteer work with youth-led prevention. And one thing that I feel like that is missing in the conversation when it comes to teens and adolescents is this idea of adult mentorship, having a coach. And in terms of a new thing now for adults is like life coaching, right? So when people say you got to go see the social worker or the guidance counselor, that has kind of a tendency to be negative versus if you have even just naming counseling coaches and making it cool for teens to check in and know who your counselor is before there's a major issue. I also think that making counseling cool as a culture is a prevention mechanism in itself, especially for the parents, because if parents are uncomfortable with counseling themselves, it makes the kids uncomfortable with counseling. So they're unwilling to go in and just ask the counselor, basic thoughts, feelings, emotions, navigating this friend stuff. The substance is kind of the symptom as opposed to giving people, young and older, permission to say, it's okay to not know what you're doing.
Right.
It's okay to not know how to handle anxiety and depression. And talking to someone is actually, not only is it encouraged, but it's cool. And that's the verbiage that I like to use when it comes to teens and parents.
Yeah, that's a good point. That's a really good point. We had Jody ask, what would you recommend to someone whose loved one is currently in recovery? So we've got treatment options. What would you recommend to them, and how can we help that loved one stay on that road?
If I may,
chime in, but I think I was thinking Frank was going to chime in first.
Go ahead, Wendy.
I was just going to say, Melanie, go. You and Frank, you guys take that question.
All I was going to say is I feel that to keep people on the road to recovery, your loved one or whatever, is you really need to learn to actively listen. Listen to what they need, what they're trying to convey to you. Maybe it is they're struggling a little bit. So, what is it? What do you need from me at this point? What do you want me to help you do? I'm not going to do things for you, but what do you need me to do for you? But to be able to listen to them, I think is a really big key for them to stay in recovery.
Yeah. I would at least add education to that. Get educated about the disease, understand the brain disease. Get involved in a 12-step program for family members, because sometimes families become so controlling and overbearing, they create enough stress for the person to end up making some bad choices because it's just adding to the stress. So educate yourself and get yourself around other people who are experiencing what you're experiencing as well.
Mm-hmm.
That's a good point.
And on that, at the Alamo Club, our board members are members that show up on a daily basis. We're all recovering alcoholics and addicts. And no one's paid for the services. And though you have professionals on the board, no one's paid. It's all volunteer work for the love of what the 12-step spiritual program has brought us back to sanity. And so when people come to us, we do have a process, if they're willing, that actually can keep you sober. And it's equalization, it's honesty, it's inventory, along with prayer. And you do, as you call it, a coach, we have a thing called sponsorship, and it's we don't force anything on anybody. They can come and go as they want, but we really encourage you. You want to stay sober, you need to be a sober person that has worked the 12 steps and have communication on a very frequent basis. And a lot of work is done outside the meetings, but we meet our sponsors and people who are truly clean from all substances in these meetings. And then you trust the process. So myself, I don't struggle with the drink or the drug. I struggle with my ego, my disillusion, being honest. These are my real defenses. And I need a person who has been through the insanity of their substance and found a way out to really relate to me. That's what makes a 12-step program so powerful. Is because the addict who wants to alcohol wants to stay sober, they know who's been in their hell and who hasn't. No pass.
That's good. So in keeping with recovery, we've got another question from Jan, and she's asking, what time frame is considered early recovery? Her daughter has 10 months clean with several slip-ups. So how can we help her navigate through that?
So, people talk about early recovery, they're typically talking about within your first year, actually, because it takes the neural pathways in your brain about a year to start to kind of rewire themselves. 10 months with a few slip-ups, in my mind is hopefully she's in treatment and they're working on a plan to identify why these slip-ups keep occurring. So Nettie, I want to make sure I understand the question. She just wanted to know what stage of recovery she was in.
What early recovery, what is that? What does that look like?
So early recovery, when you're just starting, it's almost like a baby that comes out of the womb is just opening up their eyes and it's real tiny. So you're starting to get an idea of what recovery is about. You're starting to make commitments to do things that are going to help to stay clean. You've cut off people that are not healthy for you in places, and you've made a commitment to say, I'm going to do treatment and I'm going to work on these behaviors and make these changes. But you're still just like a little baby and you still need somebody to hold your hand through this. That's kind of what early recovery is like as you think about a person that's at that point.
Okay.
Nettie, one thing that, or a couple things I think could kind of tie the last three questions together is when we're thinking of early recovery, for a lot of people, Wendy mentioned it, like the first year of total abstinence. So if we're having slip ups, it's kind of like that year progresses. In a bigger scope, it's like the first 5 years, because there is there's a trial and error period. Just stopping the substance is just the start. And then we have to learn the living skills, how do I handle my thoughts, my feelings, my attitudes, and my behaviors. And how I want to tie in those last couple of questions is, when we're talking about continuum of care, for a lot of people, that's industry speak. The average person doesn't really know what that means. But if someone is going to like residential or inpatient, think of that as like 24/7 around the clock care. And to go from that back home and expected to manage that with like a counselor every week and maybe going in to see your counselor at school, to go 24/7 to like maybe 1 or 2 hours a week is just not possible. And so that's why they have these step downs. So they'll go from like 24-hour care to like 5 days a week. So they get to go home at night. It's often called partial hospitalization. They go home at night, but they go to groups during the day. And then when they get comfortable with that, they step down to 3 days a week. They go home at night. They're starting to integrate back. And then when we transition down, we start to integrate support groups like 12-step. We start to integrate case management. We start to integrate our counselor at school. We start to integrate maybe a therapist or a counselor. And so for a lot of people that are industry speak is acute enough, us on the street is if they're bad enough to end up in residential treatment, often that baseline is 1 to 2 days a week, maybe even more of counseling, therapy, support groups, etc. Whatever that recommendation is, this is my own personal opinion, is high touch, high commitment over a long period of time. When I got sober, I went to meetings every day. Like that became, I hated it, I was forced, but eventually it became what I did on a regular basis. And I did that for probably 4 or 5 years. But I think one thing that's also missed, and I'll wrap it up with this, Nettie, is one thing that is missed often is the number one way to help your family, your spouse, your child is by helping you. One of the biggest challenges when you have someone struggling with mental health and or addiction, all the focus is on them. How do we help them? Let's send them away. Let's send them to counseling, therapy, 12-step, and let's get them to fix so they can plug back into our family unit.
Right.
But what about the family?
Right.
What about mom and dad get some help on the areas in which Melanie talked about, which is like, how do I enable? What things from my past and childhood have I not dealt with that is causing me to kind of be involved and up in my kids' stuff? So this idea of family unit recovery, we all need something. And what better way to help your kid by saying, not only should you go to 12-step and counseling, case management, I'm going to do that for families of. I'm going to go hang around with families that have experience, that have been on the road ahead. I'm going to see where I can get better as a mom, as a dad, as a spouse, so I can help you as well, because I know I have stuff to deal with too. It's a high touch, high commitment, and it's a system of care as opposed to just the person that's sick needs to make all the changes.
That's good, Preston. That's real good. I see all of the panels. Yeah, that's right. That's right. And that's a great segue. Okay, so I met Preston last Monday, and he must be right here in my head, because I'm going to segue into what do we do for families and how do they support? And I was going to go to Melanie to talk about that, but you're so true. I mean, obviously we start with the least restrictive, and then we build up if we need to, but then we start with the most restrictive and then scale down as appropriate. So that's good. So Melanie, what else can you add to that as far as family members and how can they support? What can we offer them?
Well, actually, I mean, Preston hit on all of that really, really, really well. It is really important for families to be around other people that know that they're not alone, because there is still such a stigma to admit that you have a loved one or that's, an addict and they're out doing God knows what, and, nobody wants to talk about that thing. And so families really need to be together to understand that they aren't alone. So, I mean, Preston, you hit on a lot of that, because there are so many, it goes way back to why somebody enable, why don't they set the boundaries they need to set? Why are they so codependent on their kid codependent on them? So there's so many aspects of, especially those just big 3 things right there, that if family members start to understand why they do what they do, they are better off helping their loved one. So I mean, you touched on all of that, honestly, but being around other people that has similar experiences, it's, believe it or not, what somebody else says in a group can actually help somebody else say, wow, okay, man, I've done the same thing, or I do that, so how do I not, and I always, in our groups, when we have new people that come in, they're really clearly struggling. One thing I do suggest to them is they do need to find a counselor, for them, they need to have that soundboard as well, or work out things that they need to work out from something that's in their past. Maybe it could have been a bad divorce, bad childhood, whatever it could have been.
Right.
Then they don't even realize they're putting that onto the person that, that their loved one that's an addict.
So working in the Monday setting, correct?
Yeah.
Yeah. How is that? How are you able to get families engaged? I mean, you work with adults, but Yeah.
It's really hard to get families engaged, because since I'm in Dayton, obviously we always suggest FOA there in Dayton, whatever, Celebrate Recovery, whatever support group somebody feels they can go to, and just since I've been there and listening to a lot, there's so much trauma from their childhood, from their parents. So it's just a big cause and effect of a lot of things, that there's so much more of that than what we realize that's carried over into somebody who is an addict. But then, you have your exceptions of people that didn't have that. And it's just, something that, maybe somebody introduced them to. So there's all kinds, it's a spectrum all over the place, but there's a lot of trauma.
Yeah.
I'd like to chime in. My experience is that, in fact, several men that I sponsor are sober. Their wives first went to Al-Anon. I have a bunch of really wonderful stories how they learned how not to help their husbands kill themselves by that 12-step Al-Anon program, and then how to learn when to give a hand up and learn not to indirectly encourage them to drink and drug, or allow them to manipulate you. So the whole family doesn't need to be worked on. Al-Anon is a great resource. Also, I hope I want to clarify something. When I say about the board members, when it's the professionals, they're not professionals in the field. They're professionals of lawyers and teachers and nurses. But they're alcoholics and addicts. But we do encourage their family members to attend Al-Anon meetings. I'll pass.
Thank you.
And if I could jump in real quick,
Sure.
I think, so much has been said, and excellent overview of what can help the families. But I think also families need to remember that it's taken many years for the person struggling with addiction to get to the point where they're ready to look at gaining their sobriety. So there's I know sometimes some impatience. Well, why can't they just get it? Why can't they get sober? Why can't they just quit? When it may have taken 5 years, 10 years, 15 years, 20 years to get to that situation. And then they have to learn all new skills over again and be able to recognize how they need to maintain their sobriety. And it is very important. I know I heard this several times. The family members must get help for themselves, get counseling for themselves, understand what they're going through and how they're experiencing, because as those 5, 10, 15, 20 years pass, they slowly change into what's going on with the person struggling with the addiction in the family, and they can't recognize what they're doing, what they're not doing. To get that outside professional opinion or support group opinion or another person's opinion is just so important.
That's a good point. We've talked about, and this is again fluid, and I've heard a lot about trauma. I've heard a lot about childhood. I've heard a lot about things that we were exposed to as children and how that's continued to resurface in our adult life. But I wanted to switch a little bit to talk about prevention. We do have some questions that we're going to get to in a couple minutes, but I really would like Beth and Dina to talk about that, because if we can nip it in the bud before any of this starts and start with prevention, that's the key. So what are we doing in that area in Clark County?
Well, I'm so happy to be a part of an agency not just committed to family and children, counseling for family and children, but also a commitment to prevention in our schools and our community. Wellspring invests a lot into prevention, more and more each year. My job is to teach BOTVIN. BOTVIN is an evidence-based program based on 35 years of research, proven to reduce drug and alcohol abuse by up to 75%, tobacco use by up to 87%. Kids choose to use substances for a lot of different reasons. It might be a way to deal with stress and anxiety. peer pressure or because they perceive it to be popular or cool. And a lot of times media influence has a lot to do with a kid's decision to use substances. So what I love about BOTFIN is that it's looking at not just one of those areas. It looks at personal reasons why kids are choosing substances. It looks at interpersonal reasons. It looks at environmental factors. It looks at the child as a whole, and it focuses on all of these things. It focuses on self-esteem and decision-making, goal setting, communication, in addition to teaching kids about drugs. So I'm going to turn things over to Dina here in a second, but before I do, youth-led or peer-to-peer modeling is probably the most effective way of teaching kids to do something or not to do something. Training kids to be experts and educators in the field of prevention is really valuable. It's a tremendous investment that our community is making. And I have to give a shout out to the Mental Health and Recovery Board and United Way for helping us grow youth-led in our community. Dina is a leader in our community and also at the state level, and she's doing some really great work in prevention. So I'm going to turn things over to her and let her tell you what she's been up to.
Hi. So thing is I'm involved in BATS, which I see that Deborah asked a question about what is the BATS program. So it's a community group comprised of kids from STEM, and I'm from Springfield High School. And we do alternate activities and different educational programs, and we just did something with the Clark County Health Foundation. Beth?
We worked with the Clark County Health Department on an anti-vaping campaign.
So we do all of these things to educate teens in the community about vaping and different substance abuse, but we mostly focus on vaping because it's something that is a really big issue in our community with young people. And then I'm also on OYLPN, which stands for the Ohio Youth-Led Prevention Network, which is comprised of teenagers from all across Ohio. And we plan the We Are the Majority rally, which is an event or an alternate activity talking about that the majority of teens are making healthy choices and they are choosing not to use drugs and alcohol. And I think that is a really unique event. And it's something that normally would happen in person in Columbus in May. This year it's virtual, and I'm not sure if we have a link or I can put a link in the chat. It is all about encouraging teens and like promoting these teens in Ohio that are making good choices. And it's a really inspiring event. And unfortunately, I've never been able to go to it in person, but I'm super happy to be a part of it. And it's actually a unique experience.
So part of Dina's work is just changing the misperception that substance use is popular. And Dina spends a lot of time looking with her friends at the state level at data. And what our local data is saying is that, you know, we only have 23%, I think, maybe Wendy can correct me there, of kids that are making harmful or unhealthy decisions, but kids perceive that a majority of kids are making these decisions. So correcting that misperception and helping them to feel like they're in the majority is exciting work.
Yeah, I remember when I first got involved with prevention, Beth asked me like, what percentage of teens do you think like vape at the high school? And I was like, I don't know, like 80%. And she was like, nope, it's only 17%. And that blew my mind. I was so off and had no idea. And that just it really opened my eyes to what was really happening and how so many of us think that it's a bigger thing. And how so many teens are in the majority and are making healthy choices.
It's so good that we have these opportunities available for our young children so that they can look to and have a support, because it's not always cool not to, be, I guess, with the in crowd, just like we talked about with the perception. 85% we were thinking that we're engaged in, that type of activity. So we've got about 8 minutes, and I have got to give a shout out to our participants because we're getting blown up with questions, and I apologize in advance if we're not able to get to all of them, but I want to try to answer a few. One question by Ken. Ken asked, are there any volunteer opportunities with these agencies? I'm sure that there probably are, maybe just with a show of hands. Or is there opportunities available? Wendy? Okay, yes, great. So when we finish this, there'll be information on each presenter and how to contact them. So you'll be able to pick the program that you want to work with. Maybe it's all of them, and help us out. So that would be great. I don't know if we,
Possibly at this time, talk a little bit about the coalitions that are available, that anyone is interested.
yes,
Clark County Substance Abuse Coalition, there's a youth coalition, there's the Harm Reduction Coalition that always welcome residents in the county to get involved. That information can be provided.
thank you. Kara asked a question. How do other mental health diseases such as bipolarism or depression play into addiction and treatment?
That's an excellent question. You know, people don't realize that probably about 70% of the people that we see have a co-occurring mental health disorder. At the top, we see more anxiety and depression, but bipolar is in there as well. And those illnesses have to be treated at the same time. So you can't, you know, treat one like after they get sober, then we'll address the mental health, or get them on the mental health medications and then we'll send them to treatment. Those things have to happen at the same time. So it's real important that our community resources are such where people are getting that need met. Excellent question. And one can also trigger the other. You know, if they stop taking their medications, then it could trigger a relapse. If someone relapses, then they often stop taking their medication and exacerbates their mental illness. So excellent question. They go hand in hand.
Yes.
And I just wanted to say, if our kids are telling us that they're feeling depressed and anxious, and they are, 1 and 2 are saying that they're depressed and anxious, they're more likely to try to self-medicate using alcohol or substances. And that's why prevention is so important.
Agreed. Beth, you've got a question. You might want to just answer this personally. What are the names of the programs that you teach in school, PACS and Botvin? And there was a question about something else. Joan, I don't know if you're going to answer that or not, but Beth, if you want to, that would be great.
Sure. Wellspring provides free of cost to schools PACS programming, which is teaching children at a really early age, pre-K through, you know, up to 5th and 6th grade, how to self-regulate. And it's spelled PAX. You can Google it to learn more information and reach out to us. Certainly, if your school is interested in getting trained, we'll provide training to teachers so that they can be implementing that self-regulation. It's based on positives. It's teaching teachers how to point out the positives to promote positives in their classrooms. Botvin, and I can put that in the chat box, is an evidence-based curriculum. It starts in 3rd grade, goes to 12th grade. Again, Wellspring is willing to come in and teach it in the schools, or we can teach teachers how to incorporate it in the schools. I'm really—
You're muted. There you go.
I'm really excited that we're in almost every district in Clark County. And then the third arm of our prevention programming at Wellspring is youth-led. Please feel free to reach out to me if you have middle and high school kids who are interested in getting involved.
Thank you. I've got this one question. It's kind of lengthy, but I want to read it. It's from Krista. My son has been drinking since he was 16 and he's now 39. He mostly says he doesn't have a problem with it as he doesn't drink every day. However, we are sure he is because we find the hidden empty bottles and cans. Several times we made attempts to get him help, but are always given conflicting information. Like we were told to go to a place, and when we get there, they send us somewhere else. And then that place is either closed down or is full. So we don't get help in Springfield. We can't get the help in Springfield. I believe he needs not only help with drinking, but with life choices and transition into being on his own and not depending on others for a place to live. He tends to be a couch surf. He tends to couch surf or be homeless when people get sick of his antics while drinking. Also, he can't hold a job for a long time due to drinking. I am beyond frustrated with trying to help him. Please help me.
So I'm not sure why, Krista, you're not able to get help in Springfield. I would have to hear just a little bit more about the case in terms of if he's not drinking daily, is it that he does not need medical detox, or does he? Alcohol is one of those substances that often requires a medical detox because it's very, it's complex and it's not safe to try to do that outpatient. So the person would need to go into a detox facility like Preston was talking about, that they offer that. If it's not daily and he does not need detox services, I'm not sure why he couldn't come straight to McKinley Hall. One of the benefits here is that we have the Mental Health and Recovery Board. They subsidize treatment here for people that are indigent. So I don't know. I can put my information in the chat box. Give me a call and let's talk through this, because he should be able to get help.
And if I can offer what Mercy Reach has available, if this individual is interested in treatment, all they would need to do would be to call. I know I have some brochures or pamphlets that I had submitted to Alex that, okay, back to the brochure. Okay. Well, here's the front side that anybody can come into Mercy Reach treatment. All they need to do is make the phone call, schedule an appointment. When it comes to financial, we are part of Mercy Health's community benefit services. We're part of our mission services. So if someone does not have insurance, has no coverage, they can get free care. Of course, we do require them to fill out a financial assistance form. And from there, we treatment is not based on the ability to pay. We can do assessment. We can see if they need, individual needs detoxed, and then find the appropriate level of care to help them gain their sobriety. So it's as easy as just, making a phone call, making an appointment, and, we can provide those services as well.
Nettie, I think one of the things that's important for parents to know is many times the addict or alcoholic doesn't want to get help, or they don't want to, they're not willing, or as I would say it, I can quit anytime I want to, I just don't want to. And so one, you've got to have some willingness from the person that you're trying to get help. And what this also does is not necessarily addressing this in particular, but the overarching conversation of the importance of the parents and families of getting the help. Because how do I find out how to handle a kid that needs help but doesn't want to get help? How do I learn how to go on about my life, to have to be able to be calm and to be relaxed and to not obsess about them when they don't want to get help? Well, that is going to families that have been there. It's like, if you want to be a plumber, you gotta talk to plumbers. And so parents and families of bang their head against the wall with people like me, who is under this delusion that I can handle it, or maybe I know I have a problem, I just don't want to get help. Right. And so that's where families of addicts, Al-Anon, getting our own help within the family is, how do I prepare myself for when my son says, yes, I'm ready, and we can act and not, continue to make it worse or add to it, shall we say? Sure.
That's a good point. That's a good point to bring things to a halt. I tell you, this is what happens. This goes so fast, and it's so much information, and very helpful information. So we are putting information in the chat. I apologize to those people that we weren't able to get all of your questions answered. But again, these are valuable resources in our community. We're going to show their information, reach out to them. They can get you the answers that you need. Let's put the last poll up to see what people have learned, what has changed for you after today's discussion. And it's multiple choice. I hope all of them. I hope you check all of them. Let's take a look at that. Couple more seconds. I'm past my time. I don't want to get my hand smacked, Joan. All right. 90%. Okay, good, good, good. Again, thank you for allowing me to have a conversation, be part of the conversation as we continue to address this serious issue in our community.
Thank you all. And Wendy, as always, all of our panelists have given us such great information. I mean, really, applause to everybody. Thank you for all of you who have attended, submitted questions. I do hope that you can take a look at addiction through a different perspective after today's session, and hopefully have armed yourself with some more resources. I am going to go ahead and call out, we have 12 people who are going to win one of these raffle prizes. So if I call out your name, we will have your email address from when you registered, and we'll be in touch with you to figure out an address to send your coupons. So I'm going to start out by saying Sue Green is one of our winners. And I need to write these down as I go because I have 12 to go. Nicole Smith. And I'm just calling these randomly from the list of participants. I'm going to say Nikki Baker. I apologize if I'm messing up your names. Stephanie McHenry. Polly Kraft. I hope those of you who are winning these are sitting at your desk cheering. Marina Lytle. Let's see, I'm going to go to Maria Nash.
Wow.
And Leslie Hoylman. Let's see, we will move on up to Catherine Hitchcock. Is anybody keeping count with me?
No.
9, I have 3 more to go, folks. Jessica Barger.
Okay.
And Derek Duckworth. If I get a hold of you and you don't live in our community and don't have access to these places, just let me know and I'll move on to somebody else who's been on the call with us. Denise Bell. And that's it. Congratulations. Thank you so much for joining us. I think that we can ask Alex to put up the last slide here. You will receive a survey in your email immediately following this session. We're going to ask you to fill that out to help us plan for future events. The next Break for Health session will be on June 9th, and we will be talking about how to enjoy summer fun, but safely. So thank you again so much. We look forward to hearing your comments. All of the resources that you heard about today, along with the recording of this video, will be available on the Community Health Foundation's website. You will get that link along with the follow-up email that will go out to all of you. So thanks for spending your lunch hour with us. We appreciate your support and especially appreciate the support of all of our panelists. Thanks and have a great day.